Hey. Hello, everyone, and welcome to this academic year's first climate change and urban health webinar series. My name is Usama Bilal, and I'm the co-director of the Urban Health Collaborative and one of the investigators of the Global Climate Study. So this year's webinar series will have a specific focus mostly on climate change communication. We'll have a few different webinars with people that will focus their work on this topic throughout the year. Today we have the distinct pleasure of having Dr. Manuel Franco joining us from the Basque Climate Change Research Center, BC3, over in Bilbao. Before I introduce him, I want to do a few housekeeping items. First of all, if you're interested in future webinars, please check our lineup in the Drexel's UHC and Salurval Climate websites. We'll have Jonathan Paz on November 20th, Petja Stojic on December 11th, and Paula Diaz-Levy on January 15th, and many more to come. And as I said, a lot of them very, very focused on climate change communications. Also, as a reminder, if you are interested in hearing this talk in Spanish, the talk will be in English, but if you're interested in Spanish interpretation or in Portuguese interpretation, go back in Zoom to where there is a little world sign and change the language for Spanish or Portuguese. If you want to hear the original, just keep it as is. And if you have any question for the speaker today, please type them in the Q&A section of Zoom. Which is somewhere down there next to the little world sign. So without further ado, I want to introduce Manuel, which again have the distinct pleasure of being the introducer of him. I've known Manuel since 2009. Yeah, 2009, when I emailed him to do an internship when he was at the National Center for Cardiovascular Research in Madrid, Spain. So almost 16 years. So Manuel is a social and urban epidemiologist and an ICER Basque research professor. As I said, he's at the Basque Climate Change Research Center, BC3, in Bilbao, over in the Basque Country. He holds adjunct faculty positions at the Johns Hopkins Bloomberg School of Public Health and the CUNY Graduate School of Public Health in the US. Manuel earned his PhD from Hopkins as a Fulbright scholar, and before that, he trained as a medical doctor in Madrid and in Berlin. His research focuses on the social epidemiology and prevention of chronic disease and its major risk factors. And he was the principal investigator of the European Research Council starting grant Heart Healthy Foods, which I think he'll be presenting a little bit of his work on that today from what I saw. And just as a funny thing, that was the project where I did my own dissertation a few years ago. So always fun to see it again being featured here. That project focused on how urban characteristics relate to lifestyle and health. He has published over 130 peer-reviewed articles and has raised over 3.2 million euros for his research. So, Manuel, I think the floor is yours. As a reminder to everyone, if you need interpretation to Spanish or Portuguese, go click on the world sign in Zoom. And if you have any questions, type them in the Q&A section. I will moderate that at the end. Thank you, Manuel.
Thank you all for organizing these seminars over the years. I'm very happy to be the first one this academic year. Is the presentation okay now?
Not yet. Have you clicked on slideshow?
Yes.
We are still seeing the original PowerPoint. Oh, now we are seeing the right one. Yeah.
All right. Well, thank you again for the presentation. I've had the pleasure to get to know some of you at UHC for a long time, longer time to Dr. Ana Diaz-Roux, less time to Dr. Bilal. As he said, over 16 years now. It's a true pleasure to be with all of you guys here today, trying to share some of our experiences with citizen science projects and specifically on communication in urban health research. So as Usama said from the very beginning, I was very much involved in social sciences and in social epidemiology. And social sciences relate very much, or we include social sciences in some of our projects. Journalism as one of the sciences that are important for us. And I just wanted to start focusing on why urban health research nowadays is so important. You are more familiar than nobody else in this topic. But I think this is a topic that relates to many of the relevant processes that nowadays are taking place, like urbanization, but also health inequalities and scientific endeavor, and those are important features that nowadays need good communication and need to really reach out not only policymakers but also the general public in order to make larger impacts. And that's what we have tried to do in Spain in different settings. And this is an article where we tried to reflect what it was going on in not only Madrid but also in Asturias, where Usama comes from, but also in Barcelona, where a lot of good research in urban health had been happening. And we discussed for a long time what is where we should be working, collaborating, and trying to influence, and in order to have the main impact that we want, which is to reduce health inequalities or to improve population health in cities. And for that, it's important that we do our best effort in terms of conducting the best possible research. But we need to acknowledge that those changes in our cities will not happen only from research, from our research results. Most of them, they will happen from the policy side, or when we do collaborate or understand or communicate with citizens. And that's what we were trying to discuss on that paper. The largest urban health project that I've been involved was this Heart Healthy Hoods project, where the original title was Social and Physical Urban Environment and Cardiovascular Health, the much needed population approach. And these projects, from the very beginning, we realized that had a large goal, a large part of the objective was not only to reach out in the research or to have a research impact, but also to have an impact on the general population and policymakers. I still remember how we were invited to go to the General Assembly of the city government of Madrid, and nobody had a clue what this type of research was about. And then we realized how important it is that policymakers have a more or less clear understanding of what this type of research could be. How can we collaborate with them? How can we, or we should, try to engage as much as possible with them? So for that, we put together an interdisciplinary research team where, as said, journalists, photographers, knowledge dissemination, and citizen scientists or citizen science was a big part of one part of the project. Usama was part of the design of this project, and there was a very good science data and science journalist with us, and he was part of the design of the project. And well, we were able to work and focus on the whole city of Madrid, which the municipality of the city of Madrid is already over 3 million people, and we were able to work with and collaborate very closely with the primary healthcare system. So we were able to access 1.4 million people using the primary healthcare system and trying to analyze their data in terms of non-communicable diseases and cardiovascular disease profile. So that was the main design of the project, and from very early on in this project, we started to get influence and get input from what at that point was called Citizen Science and the European Citizen Science Association. And I wanted to highlight, and I have the next two slides are about the 10 principles of citizen science. Let me see if I can do. There we go. If I can hide all this, yes. I wanted to highlight this because at the point that that we've got this funding from the European Research Council, citizen science in Europe and citizen science in European research funding agencies was a big part of what the new trend or the new way of conducting science was in Europe. So nowadays, actually, large European funded research projects mandatorily ask for a citizen science approach in order to conduct almost any large research project. And these are the 10 principles of the citizen science are already 10 years old. But I wanted just to let you know how this has become a very important trend in European research. I know that citizen science has been also used in many other places, of course, but as said, now many of these principles have stayed and are mandatory for us when conducting large research projects. So the 10 principles, the first one says citizens or citizen science projects should involve citizens in scientific endeavor generating new knowledge. Citizen science projects have a genuine science outcome. Some people think that citizen science is something else than science, and that's not the case. And that was definitely not the case in our projects. And this is type of project and methodologies that we continue actually doing right now. And I think that this is very important. This third principle, where it says both professional scientists and citizen scientists benefit from taking part of this. So the people participating, so the citizen scientists, they do benefit from this, and the way they benefit is very different from the way we do benefit, and we will talk about that later on. Citizen scientists may, if they wish, participate in multiple stages of the scientific process. This is important because this is citizen science is not only about engaging citizens to gather data that otherwise we would not be able to gather, or to provide or to generate new knowledge that otherwise we would not be able. So they can participate in any moment of this process if they want. Citizen scientists should receive feedback from the project, something that not always happens in our projects. And citizen science, as any other research approach, has limitations and biases, and we should be taking that into account as with any other methodology. This is important also as well. So the project data and metadata should be made publicly available, and where possible, results should be published open access. This is very important when you conduct very large citizen science projects where a lot of people are contributing to the data. Citizen scientists should be acknowledged in the project results and publications, and this is also different from other type of research. And this was very fundamental for us in many senses. And this is, and as said, we continue doing this type of research in Sweden and here in the Basque Country right now. Citizen science programs are evaluated for their scientific output, data quality, participant experience, and wider or policy impacts, wider societal or policy impact. This is important, and we will see how that related to two examples that I will share with you right now. And finally, citizen science project leaders take into consideration legal and ethical issues on things like copyright, intellectual property, data sharing, confidentiality, and attribution, among others. And this is important as we work very closely with citizen scientists. So I will share one example. This is the first project that we did, and some of you have heard from this before, but I'm now taking it from another angle, which is how really these projects focus or force us to do the best communication efforts as possible. And the good thing of this project is that this project was focused on, and this is in Spanish now, but well, Spanglish is our daily life. So, but I will continue in English. This was the first project focusing on food environment and dietary behaviors in one part of the city of Madrid. But we conducted the same methodology, focusing on physical activity, alcohol consumption, and then we did this also in Bilbao, Barcelona, on similar issues as physical activity and food and dietary behaviors. But then we also used this methodology and trained other researcher groups in different settings and different research questions, like we did in Sweden, where they right now we are analyzing the final results on how gig workers and delivery workers are affected in their health and well-being by their occupational activities. So photo voice methodology, of course, includes the data gathering and the perspectives of citizens, but also includes as an objective the fact that we want to have a social impact, and we want to have a communication piece as a fundamental output of the project. And in the case of this project, as said, we focused on how the local food environment was influencing dietary behaviors in two low-income neighborhoods, Los Rosales and San Cristobal. And for that, we collaborated with the Institute of Public Health in Madrid, something that we are developing right now in Bilbao in relation to extreme temperatures. So in the case of photo voice, it's very important that we have a very well knowledge and deep knowledge of who are the participants, who are the citizens living in that particular area, in those two neighborhoods in this case. And because we are going to engage only, in this case, 24 residents, and this is important because you have to develop a long relationship with these people. Actually, some of these people still somehow collaborate or are close to the research group in Madrid. Here you can see all the participants of the project, and you can see that the participants have not only their photographs, their portraits, but they have their names. So that's very different from other type of research where people are anonymously contributing to the research projects. Here is the opposite: is they're taking not only pride, but they're taking authority, agency, and property of the project. And this is a very different way of understanding research. And here was the research group, and the idea was to show that we were so many researchers and people in the research team, but also in the Madrid Institute of Public Health collaborating in this project. So normally in photo voice projects are groups of 5 to 7 people. And then they stay with us for months, because the process is on a weekly fashion, sometimes bi-weekly, but we need to convene and to work over sometimes 2 hours in group discussions. So I don't want to focus on the results for this webinar. I think this is more important to show how this project engage with the participants and provide results that are important for communication. So, of course, we published all this work. So this was benefiting us as scientists, and it was benefiting the scientific impact of this project. Actually, we were quite amazed of the long run of these articles. Some of these articles are one of the most highly cited articles within the whole Heart Healthy Hoods project. But we focused a lot on the communication of the project, and the communication of the project was not only us communicating to the world. It was actually, we tried to do the opposite. So it was the participants communicating to the world. So here I would like to stay for a second. This was a moment where we realized what is the capacity or the possibility of citizen science as a way to communicate our science and helping us to get to the general public and get to policymakers. And the reason was that at the beginning we thought it would be really great to engage citizen scientists in our own publications. And we invited these two participants, Sandrine and Jose Luis, to participate in the writing of the papers. And then they were very kind and very diplomatic, and they came to the meeting, and they gave us some feedback and blah blah blah, and then we realized that it was kind of boring for them. And then at the very end, they said, well, to be honest, to be part of your 3,500 word publication is not what we really are about. So we would like to get our ideas and get what we did out to the general public and specifically to our policymakers. So actually, they took very seriously that, for example, this day, where we very early in the morning on a Saturday morning, we went to the radio, and they were the ones who were interviewed, and they showed all the results and shared the results with over 2 million people in Spain. And 2 million people in Spain means almost 10% of the adult population, which are listening to that radio show. So that was a very important moment for them, but that was also a very important moment for the project, but also a very important moment for us to realize that sometimes it's not only all about our science, it's all about, or our written science in our articles is about trying to make a difference in other settings. And here they're showing also their photo books, something that we gave a lot of pride again. But here's the photo book. But the photo book has only certain a way of or affecting a certain amount of people. Nothing comparing to a radio show or a TV show, or even YouTube channels or other channels that nowadays I don't even know very well about communication. So another important moment of this project was when we called those citizen science meetings. Was this meeting here was in actually in the cultural center in a theater in Villaverde, and here the participants are sharing with policymakers their main results of the project. And actually, out of those people on the screen on your picture, only 3 are researchers. The rest are participants and policymakers. So it's the delegate for that district of Madrid, the person in charge of the whole health department, and the person in charge of the public health department of the whole city of Madrid were sitting there for over an hour, listening to the results of this project. And very importantly, we also did videos and exhibitions for this project. And the YouTube, for example, the YouTube video of this project has over 10,000 views. 10,000 views, comparing to somehow the impact that we sometimes have with our research, is well, it might be a good a good way or a good amount of people looking at this project. And not only is the amount of people, it's the type of people that may have been reached out by using this type of communications. With that video on the top is the one that we produced, but even our research funders produced their own video when we came to Brussels to present this project. So this is a publication by Dr. Billy Giles-Corti where she tries to make a difference, talking about how some research is policy relevant and other research might be relevant for the advance of science, but may not be relevant for the advance of policy making. And of course, you know that Billy is a big urban health person. So here she already makes us think about processes like advocacy, policy making, or dissemination strategies as part of what we could be doing or should be doing in terms of bringing scientific evidence into action. And this is something that we also said before. We reflected on that. Well, these both projects, the Heart Healthy Hoods project and the Photo Voice project within the Heart Healthy Hoods project, were funded by the European Research Council. And then people only when we included or when we were working on this citizen science idea or aspect, we were invited to go to the European Parliament to share with the policymakers in Europe about this project. And I think this was a very important moment for us as the team when we went to Brussels with participants, so with citizen scientists, with public health practitioners from the city of Madrid, and invited by policymakers there in Brussels. Actually, we were invited twice, one in the European Parliament, one in the European Commission. And as said before, in the 10 on the Decalogue of citizen scientists, I think it's important that we acknowledge the participation of all these people. And as said, one of the participants came along with us to Brussels. So out of these Heart Healthy Hoods and out of the Photo Voice projects, we have been taking part, our group in Madrid and now in Bilbao are taking part on other European projects. This one is about healthy school meals, healthy and sustainable school meals, and these are very applied projects. So we are working with communities in cities, trying to convince policymakers and school working people, trying to have an impact on what is on the menus of children. And this is something that relates also. We have written this essay about how this relates also to what is going on in cities in the U.S. like New York, and I think this idea that communication is an important piece remained on all of us in our Madrid group. So for some reason they called us from The Guardian to talk about the impact of that project, and then we realized that the people in the city of Madrid, we were very well trained actually in our group to be able to engage with journalists or with people in the media, general media in general, not only scientific media. In Spain, we have now the luxury of having what's called a science media center, and we try to collaborate and to engage with the science media center as much as we can, for sharing what we do in our research projects. And this is also important for us because childhood obesity is a big problem in Southern Europe, but of course in Spain as well. Actually, right now, the Ministry of Health is finally launching a huge campaign for of childhood obesity in Spain. So now I'm working on this center, the Basque Center for Climate Change. We had the pleasure to have Ana Diezru with us last week, and here what we are doing is well, climate change and urban health projects that includes, of course, extreme temperatures, but also, of course, as you know, droughts, floods, wildfires, and every type of health outcome that we can think of. And very interestingly, right now, because of what has been going on in Spain in the last 2 years, we have had a very serious event of a flood, which actually one of the most, not only deadliest, but most economically and infrastructure-wise devastating a catastrophe in Valencia region. We have had a whole last summer of wildfires, one of the most or worst summers in terms of wildfires in Spain, and we are now sadly used to have heat waves in our cities and in many of our countries. So for the first time now, the government is trying to find a whole country strategy for what is called the climate crisis or the climate emergency. And for the first time, the government, in power in the general Spanish government, has called the researchers to bring the background of what is about. And we people in public health, we think that everything is about public health and disease and mortality, but it's not the truth. The truth is that this is public health and health impact is only one out of 8 main axes of policy that want to be part of that of this new nationwide strategy. And we have to fight. We are 1 month later. We still have to fight that in one axis of this whole countrywide strategy, the word health comes out, and I'm not sure that we will win the battle to have health in that, because still people are thinking, general population policymakers, still people are thinking that climate crisis is about energy, is about economic loss, is about insurance, is about tourism, and it's not about health. So we have to do a lot of good communication, good scientific communication that can finally this sinks and gets into the general knowledge, I guess. So this is just to show some of our research that actually came from these heart healthy foods, and we added heat waves analysis into mortality, and heat wave analysis into first cardiovascular event incidents in Madrid. And of course, what we found is a very clear social gradient on the effect of heat waves. So again, sharing not only the science and the data and the quantitative results, but showing the inequalities of climate change and health is a fundamental piece of what we should convey and communicate. And in that sense, we collaborated with a group in Barcelona, working in El Raval, one of the most underserved communities within the city of Barcelona, and we worked strictly with migrant population on the heat wave of 2 years ago, where 3 heat waves affected the whole city of Barcelona, and we were working with a population that not only has no vacations, no free time, or no money enough to escape the city of Barcelona, but they are also living in poor housing conditions. So this is what we did in Barcelona, in El Raval, where over 50% of the population is born somewhere else outside Spain. Over 100 nationalities are present there, and we got together again using photo voice with them, trying to understand what was the results of the heat wave on that summer, and what are the ideas that they have to really being able to improve the protection, the health protection of these people. And the good thing on this is that it was very clearly, this project was very clearly designed and organized by the policymaking or the stakeholder administration of the city of Barcelona, actually in collaboration with the city of Madrid. So we could share this data also with the city of Madrid. And then what the participants came out is about housing, about public spaces, urban spaces, green spaces, or the lack of green spaces in the city, how urban renewal is not taking into account heat waves. Look at the Barcelona beach, actually. This is a reflection of what Marco, one of the participants, he took this picture and was telling us about the fact that the beach in the summer is not a place where you can relieve from heat. For example, a lot of them were saying that even if you've managed to get out of the city, your pets, your animals are not able, so they are suffering as well. And we talk a lot about adaptation, but adaptation is also at the individual level. So in this case, Jude he's a person who loves to walk and loves Barcelona from a walking perspective, so to speak. And he was telling us, like, look, during the summer, there's the only way to walk. It's 6 or 7 in the morning or midnight. So you cannot enjoy the city properly during the summer. Here, Alexandra, a woman from Colombia, originally she was telling us how she went to do a barbecue on the beach at 3 a.m. because there was no way to sleep anyway. So they decided to go at 3 a.m. to the beach. And not surprisingly, but very interestingly, tourism and touristification of Barcelona was a big chunk of the discussions that these citizen scientists had. So again, we use all this knowledge also for scientific publications, but we use this also for sharing this with the policymakers and with the journalists, and we also had a video and an exhibition that it was part of this photo voice project and heat waves in Barcelona. And just finishing, I think that these processes of communicating our science is very difficult, to be honest, and it's very difficult when we think about who are the target population that we want to get into. I try to do my best by writing in newspapers, but you only get to certain population, to certain target ages, certain target political ideology, etc. So I think that communication is something that we need to improve a lot, and to bear in mind who do we really want to target when we talk about when we talk about communication and social impact of our research. And now that I have your attention, and before I close, I would like to invite you all and let you know that the next Public Health Conference, European Public Health Conference in November 2026 will happen in Bilbao, and has in the title includes urban health, climate change, equity, and equity perspective to this program. And we hope to have you all there very soon. So thank you. And I'm very happy to discuss so much as you want. All the questions, the easy ones, I will be able to answer. The tough ones, I will send to Usama.
Okay, I'll get those. Okay, thank you so much, Manuel. So if anyone has any questions, please type them on the Zoom Q&A question. I'll start with the first one that I'm seeing here. This is from Carolina Rendon and says, what have been the biggest challenges in integrating this multidisciplinary approach that you have shared today in urban health and research and interventions?
Well, I think this multidisciplinary approach was only, we were only able to do it because we had a lot of funding, to be honest. And the funding was from the very beginning was very diverse, and also the team from the very beginning was very diverse. Building the team was not easy. So having geographers, sociologists, anthropologists, primary healthcare people, statisticians, epidemiologists on the table sounded fun, but it was definitely not that easy at some points. But we managed to do it, and then I think over the years we applied to different agencies, and we were able to hold important collaborations with other research groups, also that finally we're able to analyze the same type of data, or to gather more data in the same settings. So that sometimes it's not so much about exploiting your own data, is bringing perspectives and approaches from other angles, but in the same setting. So at the end, you have a richer data set that different people can analyze, and I think that was very useful.
Thank you, Manuel.
Pleasure.
Another question here from Daniel Rodriguez says, thank you, Manuel. Can you please talk a bit about how you and other scientists have engaged with the Science and Climate Change Communication Center that you described? He's very intrigued by it. And in what ways are they helping you communicate findings and engage with various publics?
Well, thank you for that comment and question. I think well, Anna saw it when we tried to do a small version of your symposium in Philadelphia, here in Bilbao, while Anna was with us, and we invited journalists. So we had a whole session on communication, and I think this is something that sometimes goes well because you have very good professionals that are interested in your work, and sometimes you don't. I mean, there's also some failures, or some errors, or some missing points. So I think that, for example, PC3 or other research centers, we could do much better in terms of communication. But I think it should be an endeavor that is not just us learning how to communicate, is engaging journalists or schools of journalism into what we do. So, for example, we were trying to bring. We work across the street from the School of Communication in the Basque Country, and it's not easy to develop master degrees works, or to cross the street and go to their webinars, or inviting them for coming to our webinars, etc. But I think that's something that we slowly should be building on. So it's not only about the engaging with journalists, is engaging with people who are doing research on communication, on science communication.
Thank you. Thank you. And as a reminder, please type your questions in Q&A. Feel free to type them in Spanish, Portuguese. I think we can probably do a good job getting the main meaning, or English. So, Manuel, I have a question on how you said that it's very important to put health into the climate agenda, and how some of the national conversations in Spain are less focused on health and are more focused on impact on tourism, the economy, etc., etc. In your experience with for example, the photo voice work and the community work in general, do people get that? Like, do people see climate as a threat to their health? I saw a little bit in what you said, like, I don't like going to the beach when it's too hot, but is that just a comfort thing, or are they linking that to health? Do you think?
No. I think maybe because in places like Barcelona or Madrid, the heat waves are so strong that everything changes during 2 months. So I think that nowadays we are very clearly that everybody has experience on which could be the major threats for your health or for your prevalent conditions. So, for example, the people in Barcelona were telling us, for example, one of the participants had COPD. So we were talking about how people with chronic diseases, how do they see how these heat waves are affecting them. And it was very interesting that people were saying, well, it's not only that that my glucose, my hypertension is getting worse, or is getting out of control because of the heat, etc. I don't have the nerve, or I don't have the time, and or I cannot go to the regular doctors, or to the regular nurses visits, because everything the whole daily activities change. So in Madrid or Barcelona, and during the heat wave, an old person cannot take the bus at 3 p.m. And go to the regular doctor visit, because it's scary. So it's too hot. So it's either you take a taxi cab, and that costs you money, or you don't go, and then you go the next week, or hope that the next week the heat wave will come down. For example, or some people were they're saying, and this is something that came out, we didn't ask about that, is the first heat wave in Barcelona, you're tired, you don't sleep, you're suffering. The second one, you start developing something similar to nostalgia, depression, getting mad. The third heat wave on that summer, we were seriously thinking that I was not mentally okay, and this is something that they discussed a lot. So this is, and again, photo voice, you don't interview people, you let the groups discuss. So these are things that came out from their discussions, and the same thing with you say in English, house animals or pets. So you take a lot of joy by being with your animals, but if the animals are suffering, then you also suffer. And this is something that I also didn't know about. But for example, dogs that should walk out every day, twice or 3 times during the summer, don't want to walk out. So they realize, as we do, that this is not the moment to walk out. So that affects your mental health as well. So because you are not getting the joy of being out 3 times a day. So now you are getting worried about your dog just for being out for 10 minutes.
Yeah, definitely. So it goes beyond people. It's everything that surrounds them, definitely. Yeah. Any other questions from the audience? Oh, I see a question popping up. Let me see. We have a question from anonymous participant. Thank you. I'm interested in the tourist-resident trade-off during climate extremes heat in terms of access to medical resources. Are there congested healthcare centers in our hospitals an issue for locals during those times?
Yeah, that's a very interesting question. I would say the question has at least two different answers. So local tourism in Spain means that everybody in Madrid leaves the city and everybody goes to the coast. And then we have a huge problem because the healthcare centers in the coast are over flooded by local tourists, so to speak. So that's a problem because actually we still think that, I mean, and that this is changing a lot, but we still think, I mean, the health system thinks that everybody stops in July and August, also nurses and doctors. They also want to have their vacations. So you have an overflooding of people in certain areas, and at the same time that everybody wants to have their own vacations. So it's like you have double the people and less workers. So that's a mess. And this has been going on for the last years. And this is a healthcare system problem, definitely in Spain. For example, what happens in Barcelona is that certain neighborhoods do not have local residents anymore. So if you go to El Barrio Gótico, almost nobody lives there. There's only Airbnb, and then but you have a healthcare center in El Gótico. And what happens is that nobody goes to that healthcare center because most tourists, they come to Barcelona for 3-4 days, so they don't use that, or they only use emergency services if something happens. So that's one thing. And then the other thing that we have been researching, and we just wrote a grant, a European grant this summer. We submitted it in September. Is when you talk to social services in terms of heat waves in cities in Spain, they are beginning to be very worried, for example, about homeless people. So homeless people getting services or getting aid from the cities. Normally, we were used to have alert system only when it's very cold. So the city of Madrid has an alert system, or the city of Vitoria in the south of the Basque Country has an alert system that when the temperature goes beyond -5, then everybody in the street has the right to go to a shelter. So nowadays it's not anymore about cold; it's also about heat. So and then happens the same. The emergency or the social services in July and August are almost depopulated, because everybody's on vacation. So we are not ready for having hundreds of people who are homeless in Madrid or in Vitoria, bringing them to shelters in the summer, because everybody's on vacation. Nobody, and you need to open a shelter. You need the safety, cleaning, not only the social services people.
Thank you. We have a couple more questions here from Astrid Herrera. What strategies have you considered against misinformation around climate change? And then how can we generate evidence for action to improve the health of vulnerable populations during heat waves? Two questions: misinformation and then generating evidence for action for vulnerable populations.
Well, with vulnerable populations, I think that, for example, this idea of homeless people or working with migrants in cities like or in neighborhoods like El Raval or other neighborhoods that we are trying to do in Bilbao. That's the difficulty there. I think is not so much the communication; it's actually conducting those studies. Because, for example, in El Raval, the largest minority were Pakistanis and Filipinos, and we were not able to contact or to engage with any Pakistanis or Filipinos. We didn't even know how to communicate with them. They don't speak Spanish. And we were not able to engage them. So we ended up engaging Latino communities and people who had been for a long time from Africa or from El Maghreb. So that's one thing. And then the misinformation question, that's the one that worries me the most, Astrid, to be honest. I think sometimes I feel like we preach to the choir. So even if we do very good research, or even if we do very good communication, we are targeting and communicating to people who are already convinced. Those who are not convinced of climate change, we are not reaching them, or somebody reached them before us, and we might be too late. So that's a very good question. Yeah.
Great. And last, we have a last question here. Based on your experience, how can we collaborate better across disciplines? Very easy question.
Or to be answered in 2 minutes. Well, I think in the center where I work right now is a good example. We are not separated by research areas. We are not separated in academic departments. We are not separated we are actually separated by main problems related to climate change. So we have a low carbon group, or we have an adaptation group, or we have a terrestrial systems group, or we have artificial intelligence, data mining, big data group. And within all those groups, you can find almost everything. To be honest, you can find from engineers to anthropologists to biologists, even epidemiologists nowadays. So I think sometimes kind of like the macro structure is the one that forces you to do it. So if you live in a research group, that the problem is the naming and how people are working is the problem, then automatically it doesn't matter where you come from. Or if the funding agency says you need to bring social scientists, you need to bring geographers, you need to bring, then there's no way out. So, for example, right now we are preparing a proposal for European funding for the Horizon Europe, and they explicitly say we want you to have social scientists and humanities people in your group. But there's no way out. You have to state who is the social scientist and humanities person in the group. You need to hire somebody who is doing communication, not you, epidemiologists that you like communication or not. You need to hire a communications team who are doing the communication part. So I think that funding agencies have also a big role on this.
Great, thank you, Manuel. At the end of the day, always funding drives so many of these things. So great, thank you so much. Sorry, we don't have time for more questions. So remember, these will be posted to our YouTube channel. So if you want to watch it later or share it with your colleagues, you can just go to our Salurval Climate YouTube channel. As a reminder, we have a few more webinars lined up. And Caleb, you can share that slide again, so I can remind myself. In November, we'll have Jonathan Patz from the University of Wisconsin. In December, we'll have Peja Stojic from the People's Power Health thing at Harvard. And then in January, we'll have Paula Diaz-Levy from Climate Tracker LATAM. Remember to sign up for Salurval Climate or the UHC's newsletters and to be up to date with our events. And we hope to see you in the next webinar. Thank you, everyone, and especially thanks to Manuel for accepting our invitation and presenting today.
Thank you to you all. It's a pleasure. Muchas gracias. Saludos.
Gracias.